Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery, eye and ocular adnexa part 2A. In the current session, we will be discussing about the CPTs in the range 65400 to 66030. First of all, coming to anterior segment. The anterior segment is again divided into cornea, anterior chamber, anterior sclera, iris ciliary body, lens, intraocular lens procedures and other procedures. And in the current session, we will be discussing about cornea and anterior chamber. The CPT range for cornea is 65400 to 65785. And the CPT range for anterior chamber is 65800 to 66030. First of all, coming to cornea. Cornea is again divided into excision, removal or destruction, keratoplasty and other procedures. The CPTs for excision are 65400 to 65426 and for removal or destruction it is 65430 to 65600 and keratoplasty. Coming to the CPTs for keratoplasty, they are in the range 65710 to 65757. And finally, other procedures, they are in the range 65760 to 65785. Now coming to the first CPT for excision, that is 65400. It deals with excision of lesion, cornea, keratectomy, laminar or partial except petrisium. The next is 65410, biopsy of cornea. The next is 65420, excision or transposition of petrisium without graft. And if it is performed with graft, the CPT is 65426. Now let us discuss an example. A patient presents for biopsy of cornea. Here the CPT is 65410, which deals with biopsy of cornea. Now coming to CPTs for removal or destruction. The first one is 65430. Scrapping of cornea, diagnostic for smear and or culture. The next is 65435. Removal of corneal epithelium with or without chemoquarterization. For example, abrasion or curettage. And do not report 65435 in conjunction with 04023. The next CPT is 65436. That is removal of corneal epithelium with application of chelating agent, for example EDTA. The next is 65450, destruction of lesion of cornea by cryotherapy, photocoagulation or thermal quaterization. Thermoquaterization. The next is 65600, multiple punctures of anterior cornea, for example corneal erosion or tattoo. Now let us see an example. A patient presents for removal of lesion from cornea by thermoquaterization. Removal of lesion from cornea by thermoquaterization. The CPT is 65450. Destruction of lesion by cornea by cryotherapy, photocoagulation or thermoquaterization. In the current example, the procedure is thermoquaterization. So the CPT is 65450. Now coming to keratoplasty. Keratoplasty is nothing but a surgical procedure where the affected cornea is replaced by healthy donor cornea, or simply it is termed as corneal transplant. And the corneal transplant, it includes the use of fresh or preserved grafts, and the preparation of donor material is included for penetrating or anterior laminar keratoplasty, but reported separately for endothelial keratoplasty. And do not report 65710 to 65757 in conjunction with 92025. And keratoplasty excludes refractive keratoplasty procedures which come under the CPT range 65760, 765 and 767. Now coming to the first CPT for keratoplasty, it is 65710. It deals with keratoplasty corneal transplant anterior lamellar. The next is 65730, keratoplasty penetrating, except in aphakia or pseudoaphakia. Aphakia is nothing but absence of lens in the eye, whereas pseudoaphakia means fake lens. It is a term that is used after you had an artificial lens implanted in your eye to replace your own natural lens. This is done during the cataract surgery. And the implanted lens is called an intraocular lens, IOL. IOL means intraocular lens or pseudoaphakic lens, IOL. So next CPT 65750. It deals with keratoplasty penetrating in aphakia. The next is 65755. Keratoplasty penetrating in pseudoaphakia. And finally 65756. Keratoplasty endothelial. The next is an add-on code plus 65757. Backbench preparation of corneal endothelial allograft prior to transplantation. It must be listed separately and use 65757 in conjunction with 65756. Coming to other procedures. And do not report these other procedures, that is 65760 to 65771 in conjunction with 92025. The first CPT is 65760. It deals with keratomycetes. The next is 65765. It deals with keratophakia. The next is 65767. It deals with epikeratoplasty. The next is 65770. Keratoprosthesis. And finally 65711. It deals with radical keratotomy. The next CPT is 65772. Corneal relaxing incision for correcting a surgically induced astigmatism. Astigmatism is nothing but a common imperfection in the curvature of the eye. Astigmatism is a common imperfection in the curvature of the eye. The next CPT is 65775. Corneal wedge resection for correction of surgically induced astigmatism. And for fitting of contact lens for the treatment of disease, you need to refer 92071 and 92072. And for unlisted procedures on cornea, you need to use 66999. Next CPT is 65778. Placement of amniotic membrane on the ocular surface without sutures. The next is 65778. Placement of amniotic membrane on ocular surface, single layered sutured. And do not report 65778 and 779 in conjunction with 65430, 65435 and 65780. For the placement of amniotic membrane using tissue glue, you need to use 66999. The next CPT is 65780. Ocular surface reconstruction, amniotic membrane transplantation, multiple layers. And for the placement of amniotic membrane without reconstruction using no sutures or single layered suture technique, you need to refer 65778 and 779. The next CPT is 65781. Ocular surface reconstruction with the limbal stem cell allograft. It can be cadaveric or living donor. The next is 65782. Ocular surface reconstruction with limbal conjunctival autograft, including obtaining the graft. And for harvesting conjunctival allograft or living donor, you need to use 68371. The next is 65785. Implantation of intrastromal corneal ring segments. Now let us see an example. A 53-year-old woman with scarring of the right cornea has significant corneal thinning with a risk of perforation and underwent reconstruction of the ocular surface. First of all, reconstruction of the ocular surface has been performed. and the eye is incised and an operating microscope is used with sponges and forceps to debride necrotic corneal epithelium, and preserved human amniotic membrane is first removed from the storage medium and transplanted. Transplantation of amniotic membrane is performed and ocular reconstruction of ocular surface is performed. It is removed from the storage medium and transplanted by trimming the membrane to fit the thinning area of the cornea, and then it is sutured. The process is repeated 3 times. That is, it is layered suture until the area of thinning is flushed with surrounding normal thickness cornea. All the knots are buried and a bandage contact lens is placed with topical antibiotic steroid ointment. So here what is the CPT? It is 65780. Ocular surface reconstruction with amniotic membrane transplantation, multiple layered. Now coming to next segment, that is anterior chamber. Anterior chamber, it is again divided into incision, removal and introduction. The CPT range for incision is 65800 to 65880, and for removal the range is 65900 to 65930, and for introduction it is 66020 to 66030. Now coming to the first CPT for incision, it is 65800. It deals with paracentesis of anterior chamber of eye with removal of aqueous. The next is 65810. It deals with paracentesis of anterior chamber of eye with removal of vitreous and or decision, which is nothing but incision of lens of the eye of the anterior hyaloid membrane with or without air injection. The next is 65810. It deals with paracentesis of anterior chamber of eye with removal of blood with or without irrigation and or air injection. And for injection you need to refer 66020 and 66030. And for removal of blood clot you need to use 65930. Now coming to the next CPT, that is 65820. It deals with goniotomy. Goniotomy is nothing but an advanced surgical procedure in which the surgeon uses a unique lens called as goniolens to view the structures of the front part of the eye. So the CPT for goniotomy is 65820. And do not report modifier 63 in conjunction with 65820. And for use of ophthalmic endoscope with 65820, you need to use 66990. The next CPT is 65850. It is nothing but trabeculotomy. And do not report 65850 in conjunction with 0730T. And for trabeculotomy by laser, including optical coherence tomography, OCT image guidance, use 0730T. The next CPT is 65855. It is nothing but trabeculoplasty by laser surgery. And for trabeculectomy, the CPT is 66170. And for trabeculotomy by laser, including optical coherence tomography, OCT image guidance, you need to use 0730T. The next CPT is 65860. Serving adhesions of anterior segment laser technique. The next CPT is 65865. Serving adhesions of anterior segment of eye, incisional technique with or without injection of air or liquid. Goniosynchasia. For the treatment of goniosynchasia. Synchasia is nothing but adhesions that are formed between adjacent structures within the eye, usually as a result of inflammation. The next CPT is for 65870. Serving adhesions of anterior synchasia except goniosynchasia. The next is 65875 is for posterior synchasia. And for the use of ophthalmic endoscope with 65875, you need to use 66990. The next CPT is 65880. Serving adhesions of corneo vitreal adhesions. Now let us see an example. A 60-year-old female with uncontrolled intraocular pressure and early cataracts has been coming in for laser trabeculoplasty. This is her first treatment application and she will be examined over the next 3 months to ensure normal inflammations subdue. Here the process is laser trabeculoplasty. So the CPT is 65855. Trabeculoplasty by laser surgery. Now next CPT is 65900. It deals with removal. Removal of epithelial downgrowth anterior chamber of eye. The next is 65920. Removal of implanted material anterior segment of the eye. The next is 65930. Removal of blood clot anterior segment of eye. The next is introduction CPT 66020. Injection anterior chamber of eye, air or liquid. The next is 66030. Injection anterior chamber of eye, medication. And for unlisted procedure of anterior segment, you need to use 66999. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.